Oh, welcome to calciumtherapy.com. Mark Manhart at the chair here. I just got a question from a fellow from Chicago, Irish guy. Sounds like a really nice guy. Should I visit with a hygienist before I see my dentist and discuss calcium therapy? Good question. Hygienists are the first responders, you might say. The first person you kind of have to deal with when you go to the dentist. And the answer to that would be yes and no. It'd be a good idea to know some things about calcium therapy before you talk to your dentist or your hygienist, because it has everything to do with what the hygienist is going to do and then what the dentist is going to do. So it's like kind of what I think. If you don't know what calcium therapy is, that's okay. You're not a dentist or hygienist. But I want to tell you, hygienists should know for what they can do to help people more in a more preventive way, and dentists should know. And so, about hygienists. Hygienists really can't do a whole lot in the United States on their own, and I wish they could, because in other countries, like even Canada, a hygienist can kind of have her own practice, and I think that's true in Colorado now. And so I say that they should be able to do this on their own because they are perfectly capable to do it. They are trained to do what calcium therapy does. It's their level of training, and it makes things very easy for them. And so if they're dealing with something that is non-invasive like this, they can learn how to do this. And I wish that hygienists could learn. We're trying to get into Canada and teach a hygienist. She has her own office in her own building, in her own practice. Well, we want to get her to use the calcium therapy because it's something that works fast, it's easy, it's good for the patient and the hygienist or dentist. And I'll tell you, when you get a patient that gets out of the chair and gives you a hug for what you just did with them for the last half hour or whatever, that means it's something pretty darn good. Patients will love a hygienist who does this. And we've even put together, kind of invented, a prophylactic paste for polishing teeth with the calcium material in it. And so it gives them the cleaning effect. The clean does great, polishes great, but it infuses calcium into the teeth and the gums. And we would like to have this with every hygienist because it is so preventive that when we do this, we see them 6 months later and they don't have so much calculus. They don't have so much stain. So hygienists, if you're interested, let's talk about this because it would make your profession really special. Thanks for coming to calciumtherapy.com.